The true shoulder joint, the glenohumeral joint, is the articulation of the glenoid fossa of the scapula and the head of the humerus. The glenohumeral joint has 90 to 95 degrees of abduction. There are 0 to 75 degrees of adduction when the arm is anterior to the trunk. There are 40 to 60 degrees of extension and 90 to 100 degrees of flexion. There are 90 degrees of external rotation and only 70 degrees of internal rotation because the trunk of the body obstructs range of motion. There are 45 degrees of horizontal abduction and 135 degrees of adduction. The muscles of the anterior portion of the shoulder muscle consist of the coracobrachialis, the pectoralis major, and the subscapularis. The coracobrachialis originates on the coracoid process of the scapula and inserts on the medial surface of the mid-humeral shaft. Its actions include flexing the shoulder and adducting the shoulder. The pectoralis major originates on the medial half of the clavicle, sternum, and cartilage of the 1st through 6th ribs. It inserts on the crest of the greater tubercle of the humerus. Its actions include adducting the shoulder, medially rotating the shoulder, flexing the shoulder, horizontally adducting the shoulder, and extending the shoulder. The subscapularis, although labeled on the back, is actually an anterior muscle on the anterior side of the scapula. It originates on the subscapular fossa of the scapula and inserts on the lesser tubercle of the humerus. Its actions include medially rotating the shoulder and stabilizing the head of the humerus in the glenoid cavity. The superior muscles of the glenohumeral joint include the supraspinatus and the deltoid. The supraspinatus originates on the supraspinous fossa of the scapula and inserts on the greater tubercle of the humerus. Its actions include adduction of the shoulder and stabilizing the head of the humerus in the glenoid cavity. The deltoid muscle is a multipinnate muscle with fibers running in different directions, which creates different actions at the shoulder. It originates on the lateral 1/3 of the clavicle, on the acromion and the spine of the scapula, and inserts on the deltoid tuberosity. Its actions include abduction of the shoulder, flexion of the shoulder, medially rotate the shoulder, horizontal adduction of the shoulder, extension of the shoulder, lateral rotation of the shoulder, and horizontal abduction of the shoulder. The posterior muscles of the glenohumeral joint include the latissimus dorsi, the infraspinatus, teres minor, and teres major. The latissimus dorsi is the most superficial of the posterior muscles. It originates on the inferior angle of the scapula, the spinous processes of the last 6 thoracic vertebrae, the last 3 or 4 ribs, the thoracolumbar aponeuroses, and posterior iliac crest. It inserts on the inner tubercular groove of the humerus. Its actions include extension of the shoulder, adduction of the shoulder, and medial rotation of the shoulder. The next posterior muscle of the shoulder that is deep to the latissimus dorsi is the infraspinatus. It originates on the infraspinous fossa of the scapula and inserts on the greater tubercle of the humerus. It laterally rotates the shoulder, adducts the shoulder, and stabilizes the head of the humerus in the glenoid cavity. The teres major and teres minor are the deepest of the posterior muscles. The teres minor originates on the upper 2/3 of the lateral border of the scapula and inserts on the greater tubercle of the humerus. Its actions include laterally rotating the shoulder, adducting the shoulder, and stabilizing the head of the humerus in the glenoid cavity.
The teres major originates on the inferior angle and lower 1/3 of the lateral border of the scapula. It inserts on the crest of the lesser tubercle of the humerus. Its actions are to extend the shoulder, adduct the shoulder, and medially rotate the shoulder.